Hello and welcome to this video on immune balance. If you're watching this video, then you're getting to know your causes questionnaire, and my message probably flagged up that your histamine issues might be something to do with your immune system and how that's balanced. So what we're going to cover in this video is just explain a little bit about the links between histamine intolerance and immunity. And I'm going to explain to you about two different arms of the immune system called the Th1 and the Th2 system. Then we'll talk a little bit more about Th2 and how that's linked with histamine, and something called your mast cells and how they can be involved with histamine. Finally, we'll talk about how to balance the Th1 and Th2 immune systems to help you reduce your sensitivity. And we'll talk about testing that could be helpful. At the end, as always, I'll give you a few next steps you can complete to start to address this root cause of your histamine intolerance. So first of all, how are histamine intolerance and immune balance linked? In our bodies, histamine is produced by something called mast cells, as well as a whole bunch of other cells, but especially the mast cells, which are part of the immune system. So it's actually our immune system that produces these histamine in large part. When we have an allergic reaction, so when we're actually allergic to a substance, our mast cells degranulate, so lots of them, in a way, explode in response to the allergen. And when they do that, they release huge quantities of histamine, which is why it can be so dangerous to be exposed to an allergen. When we have a histamine intolerance, smaller things might trigger the mast cells to either degranulate, but not in such quantity, so it's not such a mass exodus as when you have been exposed to an allergen, but some of your mast cells might degranulate or explode, or they might just release histamine. And that then causes your histamine symptoms. What triggers these mast cells to release histamine are your typical histamine intolerance triggers, so foods, stress, and trauma. What research has shown is that people with histamine intolerance often have more mast cells and more sensitive mast cells than controls. This means that when you're exposed to triggers like food, stress, and trauma, there are more cells to react by releasing histamine, and they're more likely to do that than they would be in people who don't have histamine intolerance. These are some of the other cells that produce histamine. So it's not just the mast cells, but they're the ones when you have histamine intolerance and an immune imbalance, the mast cells are the ones that are most likely causing the issues for you. So what are these two immune systems, the Th1 and Th2 system? So the immune system has many different arms. Traditionally, we think of you need to boost your immune system so it works better. But actually, the immune system has these different arms that don't all work at the same rate. So the more boosted one arm of the immune system is, the less boosted the other arms will be. And the Th1 and Th2 systems are two arms. There are more than this, but these are the ones we'll focus on today. The Th1 system helps your body fight bacteria, viruses, and fungi. So if there is a flu going around, you might want to boost your Th1 system so that you're better at fighting off the viruses. The Th2 system responds to allergens and parasites. So this is the system that will cause reactions when you have hay fever, for example, or if you have a worm infection in your gut, for example. And the Th2 system is also the one that works with histamine. For example, histamine is what the body uses to call the immune system to come to a site where there is a parasite to destroy that parasite. So it's actually quite helpful when it's used right. Like I said, the more active one arm, the less active the other. So if your Th1 system is boosted, you've been having lots of ginger tea, for example, echinacea, you've been really trying to get yourself ready to fight a virus, your Th2 system is probably less active. So you're maybe less responsive to allergens or irritants in the air. So when it goes the other way, when your Th2 immune response is overactive, that means your Th1 response is impaired. So you're less able to fight infections like viruses. And the problem with this is that when we have a chronic infection, like for example, herpes virus or Epstein-Barr virus or chronic sinusitis or recurring UTIs, recurring thrush, anything that's recurring means that our Th1 system is not working very well because we haven't been able to fight this infection off properly. And our Th2 response is promoted by the inflammation from that infection. So the longer we have a chronic infection, the more active our Th2 response becomes, the less active our Th1 response becomes, the less good we are in fighting the infection, the more inflammation we have, so the more the Th2 response is promoted. So you have this really vicious cycle where your Th2 response just becomes increasingly active. Throughout your life, you've noticed you're becoming more and more reactive to different foods, different triggers. And maybe you've also noticed that there is some kind of chronic infection or inflammation that's just not going away at the same time. That's why very often when you have these chronic infections in hollow spaces, so for example, chronic gut problems, chronic bladder problems, things with your vagina, things with your lungs, your sinuses, they're really often a clue that something is going on with an overactive Th2 response and an underactive Th1 response. So how does this Th2 system link with histamine? Various ways. So the more active the Th2 system is, the more likely your mast cells are to degranulate or explode like they would in an allergic reaction, releasing lots of histamine into your tissue, causing a reaction. And they become more sensitive. So even when they're not degranulating, smaller things like a little bit of stress might cause them to release a little bit of histamine. So they're just very overreactive compared to how they should be. And you have more mast cells. So the more active your Th2 system is, the more mast cells your body produces, so the more cells there are to produce histamine. And all of that together just leads to an increase in histamine release, which is very inflammatory. And the more inflammatory signaling there is, the more Th2 responds. And the more Th2 responds, the more likely your mast cells are to react, and the more mast cells you have. Th2 also triggers IgE. So this is an immune signal that the body uses to signal that something that shouldn't be there is entering your body. So it's normally associated with allergies and intolerances. And that's actually one of the things that triggers the release of histamine from mast cells. So because Th2 is the immune system that's there to tell your body something foreign has invaded us, like a parasite or an allergen, it produces this IgE, and then histamine is released more from your mast cells. The reasons that histamine promotes an increased Th2 response is that histamine triggers the release of Th2 messengers. So some of you may have already heard of cytokines before. And these are just immune system messengers that turn on and off different immune responses. And histamine triggers the release of lots of cytokines, you can see their names there, that tell the immune system to upregulate the Th2 response. And as a double whammy, they stop the release of Th1 messengers. So suddenly there's lots of messengers signaling to the body that the Th2 system needs to be upregulated, and there's less and less messengers signaling for the upregulation of Th1. And that's when we get that imbalance where we have an overactive Th2 and an underactive Th1 system, and we very likely are starting to have issues with histamine. So to illustrate that a little bit, let's take the example of some gut inflammation, for example. So you've got inflammation in your gut, the lining of your gut has been damaged, possibly by the inflammation, possibly by what's causing the inflammation. And that activates your mast cells. So wherever there's inflammation, the mast cells get turned on and they start to produce histamine and those Th2 messengers. That then activates your Th2 immune system, and the Th2 immune system means your mast cells become more sensitive and we get more mast cells. And those mast cells, like the ones at the beginning that were activated, degranulate and they release particles which trigger the inflammatory response, and one of those particles is histamine. And the inflammatory response triggers more mast cells to release more histamine. So we end up with these really high levels of histamine. And now part of the problem is high levels of histamine, the particles released by the degranulated mast cells, all activate the Th2 immune system more. So we get even more mast cell density and sensitivity, even more response, even more histamine and other inflammatory messengers released, higher levels of histamine. Now, those high levels of histamine actually cause damage to the lining of the gut and cause inflammation there, which feeds into this whole cycle we've already looked at, but also the inflammation and damage of the gut lining means that we have a reduced capacity to produce DAO. And you'll remember from last week that DAO is the enzyme we use to break down histamine in the gut. Now, the less we can break it down, the more the levels of histamine build up. And so this cycle starts to repeat itself and feed itself. And that's why histamine issues often start off quite small and then might become much bigger if they're not addressed. And so what we try to do in our sessions now is to reduce the activation of the Th2 immune system, reduce the production of histamine by your immune system, address inflammation in your gut or any other lining where there is inflammation, and increase your body's ability to produce DAO. So that's what we're aiming for. Not a quick task, of course, but this course is your jumping off point, and hopefully after today's session, you'll understand a little bit better what you need to do. And if you've noticed that, okay, I think I have a chronic infection or inflammation in my gut, in my vagina, in my lungs, in my sinuses, then you also want to be watching the infections and parasites video. So, not everyone who has histamine intolerance has their mast cells so actively involved. You saw at the beginning that there are lots of cells that can produce histamine, and for some people it might just be that because of their hormone levels, there are certain cells that are producing more histamine and that's causing symptoms. Or it might be that their diet is really high in histamine and that's why they have symptoms. Or it might be that they are taking medication that stops the production of DAO so they can't break down histamine. So not everyone who has an histamine intolerance has mast cell involvement, but those people who have a more severe histamine intolerance usually have mast cell involvement. So if you are really sensitive to lots of different foods that maybe other people with histamine intolerance can tolerate, then it's quite likely that for you mast cells are involved and are very active. And one other way to tell is that mast cell reactions commonly trigger muscle cramps, and that's particularly common in the stomach. So if foods trigger these very severe cramps in the stomach for you, then that's a sign that mast cells might be involved. Mast cell reactions are also immediate. So as soon as you're exposed to a trigger, you notice a response. But when your mast cells have been sensitized, they can remain active for weeks and months. So it might be that there's a trigger that triggers this immediate response, but then you've got suddenly more and more active mast cells, and those will remain active for weeks or months. So you might notice that your symptoms are triggered suddenly, and then they stay around even after you've removed the trigger. And you might notice that when you make changes in your life, it takes some time for you to start to feel better. And I just want to be really clear that that's really normal. You need to give your mast cells a few months to calm down. They are super overreacting at the moment and they cannot just be turned off. We need to calm them down slowly and kindly. So don't stop doing something just because it hasn't helped after 2 weeks. It's also exacerbated by repeated exposure. So if you know you've been chronically exposed to chemicals, a toxin, molds, or a chronic infection, that means mast cell involvement is more likely. So again, watch the infection and parasites video because that will give you some more information about how to address these issues. But this is another clue for you that mast cells might be involved. And again, damage to any kind of lining of any hollow space, like your gut, your lungs, your sinuses, your vagina, your bladder, anything like that, chronic UTIs, sinusitis, thrush, bacterial vaginosis, gut problems like IBS, Crohn's disease, anything like that means there's likely to be mast cell activation. So what do we do? What we want to do is we want to balance the Th1 and the Th2 system. And as you remember from the beginning of this video, when your Th1 system is very active, your Th2 system becomes less active. So we want to start by upregulating your Th2 system and upregulate Th1 and downregulate Th2. So we want to know what is activating the Th2 system. So other than what we've already talked about, high blood sugar levels can activate Th2, poor gut lining integrity, traumatic brain injury, stress and trauma, chemicals, chronic infections, and exposure to allergens. So these are some of the ones we've talked about: inflammation, allergens, stress. But the other ones are really important as well. So you really need to make sure you're controlling your blood sugar well, you're removing the exposure to chemicals wherever you can, you're managing stress, you're getting support if you've had exposure to trauma, things like this. And age. So this one we can't do very much about, but it's just good to know that the older we are, the more we need to support our Th1 response, because it naturally becomes less active, whilst the Th2 response naturally becomes more active. And that might just be because throughout our lifespan, we've been exposed to so many different toxins, parasites, all these things that would be activating the Th2 system. So the first step, like I mentioned, is upregulating your Th1 system. This is always where we start, because if we just try to downregulate Th2, we might accidentally also be downregulating Th1, which is not what we want to be doing. So the first step to upregulating Th1 is managing stress. So watch the stress video this week as well. You will know this because you will know that when you have particularly stressful periods in your life, you're much more likely to come down with a cold or a UTI or some other kind of infection. And that's because stress downregulates your Th1 system. So you need to be really mindful of your stress levels during this period where you're trying to rebalance Th1 and Th2. You also need to prioritize good sleep. Again, you'll know that after a few sleepless nights, you're much more likely to get sick, and that's because poor sleep downregulates Th1. And again, we cover that a bit in the stress video. Some foods you can try are ginger and sulforaphane-rich foods. So that's cruciferous vegetables like broccoli, kale, Brussels sprouts, cauliflower. You'll find all of this on this week's Immune Balance handout. And then there are some supplements. Now, I'm giving you the name of these supplements, but I do not recommend any of these just because I've said maybe you've got a immune imbalance. So you really need to work one-to-one with a qualified practitioner to make sure that the supplements you take are safe with your other medications, that they're at the right dose, that they're in the right combination for the right length of time. These are supplements that can help, and if you know that maybe your immune system needs a little extra work, I would recommend booking a one-to-one session with me so we can design a personalized supplement protocol for you. The next step is downregulating Th2. And that also starts with managing stress and prioritizing good sleep. So it's a double whammy when you're doing those two. But you also need to reduce non-purposeful inflammation. So anytime there's inflammation, we're triggering a Th2 response. And so you need to make sure you're regulating your blood sugar well, you're avoiding processed foods and sugars and refined carbohydrates, you're reducing your exposure to toxins and allergens, and you're reducing your stress levels. Again, all of that is covered in a bit more detail in this week's Immune Balance handout. But all the foods in the meal plans that I'm providing you with are processed food free. They're free from a lot of allergens. They are made to help you regulate blood sugar. So eating in this way for these 3 weeks should already be a big step towards reducing non-purposeful inflammation. Now, foods rich in quercetin also downregulate the Th2 response, and some examples are wild blueberries, not the typical big American ones, but the Nordic ones, which are smaller and bluer, onions, kale, broccoli, apples. So those are all low histamine foods, except the onions, but they're just a one on the list, so you can easily include small amounts of onions. Apples have great antihistamine properties, so I highly recommend them as a daily snack. Kale and broccoli have lots of other benefits. They're rich in sulforaphane, so they upregulate your Th1 system. And wild blueberries are delicious and also very rich in vitamins and antioxidants. So really easy foods to include, on a daily basis if you can. And again, some supplements, which again, you would need to work with someone one-to-one to decide which supplements are right for you at this time. Now, you can also do some testing to find out about your immune balance. One thing that doctors do to test for mast cell degranulation is they measure tryptase, because very high levels can indicate mast cell degranulation. The problem is the levels have to be really high for doctors to take note of this, so it's not always useful. The other thing you can look at is a full blood cell count and see whether your eosinophil count, which is one of the white blood cells, is high, because that can indicate Th2 dominance or parasite infection. So it can be helpful to ask your doctor for a blood count, see what comes out of that, and you can write to me if you want me to help you understand your test results a bit better. But unfortunately, there aren't actually many blood tests, serum tests, things we can do to really understand the immune system because it's so complex. The markers are quite difficult to measure, it's very expensive. It's just difficult. And so there's been a questionnaire designed by something called the Cogence Immunology Institute, who really focus on our immune systems and who do a lot of research. And this questionnaire calculates your likelihood of having a Th2 dominance. That's on your Practice Better account, and it's one of the questionnaires that I would recommend you complete this week. And I'll send you some feedback on that once you've completed it. And like I mentioned, if you want any help interpreting anything, write to me on Practice Better and we'll make a plan. So what you need to do this week is do the Th1 and Th2 questionnaire. Then you need to read the immune balance handout and just highlight or tick off any changes you will make over the coming weeks. You'll know what's most relevant to you, what you're already doing, what you need to do more of. So just tick those things off and then start to prioritize them in your day-to-day life. You can find your questionnaires and handouts when you scroll down on the module page on Practice Better, so it's underneath all the videos, so you'll have to scroll right to the bottom today. I hope this was helpful. As always, there's lots of references, so the slides will be uploaded, and you can look at those if you'd like. If you have any questions, write to me or reach out on the group chat for some support. I know this week is overwhelming with lots of information. And remember that on Friday we have our group Q&A session. So if you have any remaining questions, check in there and I'd love to see you and answer all your questions. I wish you a wonderful day.